Hello everybody, welcome and kumusta? Thank you for joining me. This is How, your occupational therapist, and welcome to Occupational Therapy Conversations. What are we going to talk about today? In this episode, it's just a conversation, just you and me. I am driving home and what happened at work? I know there is this topic and issue that came about, and it is a point of conversation and a point of debate. It's not yet a big debate because I have not had any conversations with colleagues yet, and peers for that matter. The concept of suctioning. I am a member of a peer group in the country, and there's this conversation about occupational therapists needing to do suctioning in critical care. And to be fair, I have not looked into the details of it yet, but basically it comes down to suctioning and OTs being allowed to suction. Now the question for me is, do I agree or do I not agree with it? It is a serious topic. Okay, let's clarify. Why do we want to suction? You want to suction because something is happening in the airway or in the oral cavity, and that there is a lot of accumulation, whether it's be fluid or thick mucus excretions in the area, and you need to take that away. Now, as an occupational therapist, can we take this away? Yes or no is the first question. I can't remember if I've had an episode about OT and dysphagia yet, or I must have done, but I'll have a look at that. Look at the past episodes. Like I said, in this country, OTs do not do dysphagia, although in North America they do. So colleagues across the pond, they do. So if you're working on that and you're working on dysphagia, then yes, we can look at suctioning, and it's one of those things that you can clear the oral excretions, or those that are too much saliva, for example, or whatever pockets of food that's there. Then yes, we can suction it, especially if the patient does not have the oral motor control to spit or the lingual control. Then yes, suctioning is there, but the person, while they are doing their dysphagia management, would have been upright, should have been upright, would have been alert, and would have been actively engaging with therapy. Okay, so that's that. What about suctioning? That involves the suctioning of the airway. So which part of the airway needed suctioning? Right? So does it go up the nose, onto the pharynx, or just down on the tracheostomy site, up into the bronchus, upper airway? Now, this becomes a different scenario. Say you are in critical care and you are doing some restorative program and restorative interventions, and you are providing this component restorative program. Yeah, the person is weak and you're doing this musculoskeletal retraining. So you're doing some facilitatory input and preventative input, for that matter, which involves you manipulating the muscles. So they cannot engage yet in any therapeutic activities or enabling activities. You're more on the adjunctive phase and you are preventing the problems, right? Say you're doing that and the person that you are working with, they are on they're on tracheostomy and they cannot engage because they be coughing. The nurse would be there. Yes, you can call a nurse to do that. But what is stopping you from making that patient comfortable then and there by clearing everything up and just doing it so that you can carry on with your session? If it is a basic skill, an essential skill, I think we can and we should be allowed to suction, which is actually, it seems to be at par with these critical care capability framework that's actually been out. The more I think about this, the more I am veering on the side that there is a possibility and a need for us to develop that skill of doing suctioning, just so that we can alleviate and relieve the person of any discomfort, immediate discomfort, while they are having therapy sessions with us. And so there is a call for that. Initially, I thought we shouldn't, because it's on the organ level. I think in the middle of your therapy sessions, when the person is actively engaging with you and you're not doing respiratory therapy, you are doing therapy to restore and prevent deterioration on the muscular capacities, rather than wait for a nursing staff to be there, then we can just simply get the equipment, put it in, do, and then pull. And then once you have and we're able to clear it all out, then we need to learn to document that during the session as well. So there is that identification that we need to actually document what has happened and that suctioning was done. So yeah, based on that, I would agree. So there are two ways so far that I find where suctioning can be allowed for occupational therapy. One is when we're doing oral motor retraining and we needed to clear up the oral cavity when we're doing dysphagia management. Mind you, it's not yet in the process, it's not yet in the system that we are doing dysphagia in this country, and yet it's going to go there eventually. It is a role that we need to address It's a role that we need to explore. So yes, that's the one that's doing that. The other time where you can do the suctioning is if you are there on your own and you're doing a solitary session with the patient, particularly on addressing and resolving performance components, the muscular capacities, the musculoskeletal capacities of the person, then yes, we can do that to alleviate discomfort, and at the same time so that you can carry on doing what you need to do with the patient. And those are the terms and conditions, I would say. But if you are there to provide respiratory rehab, then no, I don't think that should be the reason. Yeah. What about when you help out on the deep breathing? Is that something that you would do with the patient? Yeah. If you're leaning forward, if you're facilitating a person leaning forward to get that postural control, to maintain the postural control while they are in critical care, and then all of these airway problems happen, there are some blockages that you need to clear out, then you might as well be prepared for it. I wonder what happens during physio sessions. Normally when they're at that basic level, people would have joint sessions. There'd be two therapists. So one is holding the therapist, the other one is doing the suctioning. And then the other one would be, I guess the nurses should be there. But yeah, I really now am convinced that there is a role to do suctioning to preserve the person's comfort, to maintain the patient's comfort in the middle of their session with you. So the session may not be for the purpose of airway clearance, but when there is a need to do that while you're having a session, then that calls for us to do that. Equally, in parallel, it's almost parallel to a time where you're doing a functional mobility retraining in the hospital and in the unit, and then all of a sudden the person felt like needing to go to the toilet, and it needs to happen then and there. And so you may just have to do that essential personal care thing. You'll have to wipe the bottom of your patient, don't you? Are you going to abandon the patient and then call the nurses? I don't think you would, isn't it? You'll have to do it. When it happens, it happens. Okay, guys, there you go. I think I was in the purpose. I was in the mission of saying no, we shouldn't do suctioning because we're occupational therapists. But if it is, and if it is within, in the middle of the session, if it is in the middle of the session and it affects the person's discomfort, and in the absence of somebody who can help us, like the nurses, then we need to be equipped with that skill of knowing how to suction. So how do we move forward based on this? We need to develop that protocol, that education protocol on us doing developing that skill of suctioning. Okay, it's easy enough to do, but it's got to be done in a standardized way And it's one of those things that we need to do. All right, guys. Well, thank you so much. I hope you find this conversation a little bit enlightening, as it has enlightened me. If you enjoyed this talk to your friends about it. Learn together, grow together. Have this discussion over a cup of tea. Learn together and grow together. Just remember, guys, anything you do matters and has an outcome. Until next time, this is how your OT. Bye.